I'm Dr. Stanic, inventor of EBRT or Edentulous byte record taking. Today I would like to share with you the steps how we do this. But before that, let me show you the components of EBRT. First, we have upper plate where we will take the recordings, and the lower plate that holds the housing for the pin to establish vertical dimension and to do the recordings. So before you start taking an impression with EBRT, I would place the tray adhesive for impression material on upper and lower, and then take the impression. Impression doesn't need to be deep, or it's just to take a orientation so that both plates will stay. This is an example of good one where I have here for this patient. These are not functional impressions. These are impressions just to hold plates in a place where you're doing records. After that, I would place the pin on the lower tray from the impression side toward the upper plate, and by turning the pin up and down, you establish the vertical dimension that is appropriate for the patient at situation. Once the vertical dimension is established, you can practice with patient to do protrusive and lateral motions. After that, you can place markings on the upper plate. You can use a Clued, Sharpie, crayons, anything of that nature will work. Place it back in the patient mouth and have patient move his or her jaws forward, to the left, to the right, and with light pressure, so that will make the markings on the upper plate. Take the plate out when you're done with that and read the markings where all three lines meet. You make a small indentation with round burr 4 or 6, whichever you prefer, so that when you put it back in the patient mouth, you'll have patient to close back into that pin, so that you know that the patient is in most repeatable position where all the muscles are relaxed and at the balance. Once you're done with that, check for the AP rotation, because if the patient is prognatic, the upper tray might tilt down while they're doing the motions, and that will give you open bite at the end on the dentures. So check for that. If that's okay, fill the space between the trays with bite impressions. I would add a little bit more of it in the front, so that when a patient closes their lips, you'll have a lip line before taking it out. Put with a Sharpie, mark the midline, and you have impression record ready to, and you have a record ready to send it to the lab. If you want to see how I did this with a patient, you can view the other video on this channel.